Okay, so today we are going to review um, where and how to upload, and we're going to kind of go in the order of the cores as they're listed in the guidebook. I'm going to basically really talk through documents needed for each core, and then any items of considerations with those documents. After we review all the cores, we're going to talk about the process for both on-site evaluations and for Zoom evaluations. At the end, we'll have time for Q&A. If you have questions while I'm presenting, feel free to raise your hand, type in the chat, or you can wait until the end. Madison, I believe, is on here, and she's going to help kind of field some questions. But this is kind of designed for anyone going through the evals, whether you're brand new and this is your first eval as an employee in a home, or if you've been doing it for years. So we'll go ahead and get started. So first, how to submit. You can upload through Qualtrics. This is our preferred method. That way it's already digitally converted. You should have had the link in your email whenever we sent the original email that had your home's eval date or sign up. And it's also on our website. If you choose to, you can also fax or email, and those numbers are listed there. The main thing is that all documents need to be submitted the Friday 2 weeks prior at noon. So that way our team has time to get those downloaded and review them and be organized prior to your eval. So that way we can be quick to get you guys results after we're done. And then, so I've also attached just the link. So it's the Qualtrics to our website. And so it's the same process that it's always been for several years now. We only need one document submission per home. And like I said before, the documents are due 2 Fridays prior to your evaluation at noon. So we ask that before you go ahead and start uploading, just wait to get all the documents needed and then just do it in one swoop. It's easier for us to go back and check them. If you guys say, hey, did you get X document? It's all on one spot rather than us having to go check each submission. So we're going to click on the Qualtrics link and we're going to go through the process. Okay, let me make sure. Okay, I want to make sure that you guys can see the Qualtrics K-State website. Can someone confirm that in the chat? Okay, perfect. So, first of all, you're going to pick which home you're with. So you'll find your home here. And like the instructions say that if you cannot find your home, either give us a call or an email, and then we'll work through it. We will just pick Advina of Clay Center since they're at the top. And then we are going to select the cores that we are working on this year. And so we're just going to pick food and sleep since they're at the top. But you can click as many as you want. And then we'll scroll down and go to the next slide. And then so what's great about this is that it prompts you what is needed. And then all you have to do is click and drag, or you can click left click the box and open and select from your files. So obviously for this one, they want the 2 weeks of menus and your alternative always available. And then if you have something else cool that your home is doing that you think would benefit you in this category, if you have pictures of anything, this is where you could upload it. And so after you um, upload the things that you need to, you just hit the next button, and then it takes you to the next core. Um, so again, it prompts you what is needed, and then any um, other extra information like a floor plan. It can just be your fire evacuation plan. Um, and then same thing, just click and drag or upload. And then you go to the next screen. And then if you have any feedback for our team, feel free to type it in there about the evaluation process. And then this is a reminder that we do have the KCCI survey, so it's the Kansas Culture Change Index. That is due April 15th, and we'll talk about that here in a little bit. But 6 people from each organization, so it can be the administrator or director of nursing, 2 CNAs, and then 3 other people have to complete this by April 15th. This is a requirement of being in the program. The benefit of this is that it helps your home track your progress compared to all of the other homes in the program. So like it says here, it's just a learning tool to see how your home perceives performance. So if you want a confirmation email, just plug it in there. Next screen, and then thank you for taking the survey. So that is Qualtrics. So nothing has changed on that. So we'll go back to the PowerPoint. Okay, and it should be back on the PowerPoint. If it's not, please let me know. So like I was saying, so for food, and we're just gonna go in order through the guidebook on these. So the 2 weeks of cycle menus will need to be uploaded. I'm having problems with my computer, 1 second. Oh, so we are going to be looking for 2 weeks worth of menus. And a list or a picture of however your home does the always available and the alternative menu if you have that. For sleep, we want to see any interview tool or anything that you use to collect information about residents' sleep preferences. The overnight CNA and nurse mini care plan sheets that outline residents' overnight care, instructions for incontinence care needs or repositioning needs. Homes call these different things. So whatever your home calls it and uses, that's what we want to see. Following are some examples, what they call, but it's not meant to be an exhaustive list. It could be your jot sheet, your Cardex, your QI, pocket care plan, CNA, whatever your home uses, or a task sheet. That's what we're looking for. We want to have examples of weekly, monthly, or 2-week staff schedules for each work area that have been filled out. So please give us a key with that or directions on how to read the schedules. If you're also being evaluated on relationships, you only have to submit this information 1 time. So don't feel like you have to do it twice. If you do it twice, it's not a big deal. We need the Building floor plan, like I said before, this can be just the fire evacuation plan that you already have posted with work areas identified, including the number of residents who live in each work area. If you're also being evaluated on relationships, again, this only needs to be submitted once. And then for mental health homes only, they may submit the schedule and floor plan if they choose to do so, but they are not required. So for bathing, what we want are samples of any information collecting tools used to gather resident bathing preferences. Any samples of curriculum used to train staff on bathing alternatives. Um, if your home has created a training, we just need what that outline looks like. If you do bathing without a battle, just tell us that you do bathing without a battle. Just a forewarning, I think we've really tried to communicate this, but we have not seen anything that's been posted on Relias that is sufficient on bathing alternatives. So if you have any questions about that, please reach out. But right now, we haven't seen anything that is sufficient for this. Attendance records of the bathing trainings. And so be sure to include the total number of direct care staff members in total at your home. And we are looking for your home to meet that 90% threshold. Keep in mind that you do not have to include your PRN staff in that training, in that total. We also need a copy of an individual resident care plan, and we want it to be something that really highlights the use of alternative bathing methods. So basin bath, sink bath, towel bath, any products that they use as an alternative approach if their typical thing doesn't work. Please only include this portion of the care plan. We don't need to see the rest of it, since that's not what we're looking for. But also please make sure that there's no identifying information on any care plans that are submitted. I'll say that multiple times more throughout this call, but we don't want any resident information. Daily routines. So for daily routines, again, we want a sample of any interview collection, tools used to gather information about personal routines and preferences prior to move-in. And then we also need some care plan attendance records. So in the last 3 months before your evaluation, so if you're February, you can do January, December, November. You want to choose one full calendar month, and we need to know the total amount of care plans, and then the number that was attended by the resident and or family or slash designated decision maker from that month. And then we need to know the number that was attended by the direct caregiver from that same month. These records can include attendance by conference call, Skype, Zoom, whatever technology. It doesn't have to be the traditional in-person. We just want to make sure that they're being involved in attending the meeting, and we want to make sure that you guys are capturing that in their attendance records. So that is that. And then we want to have 2 to 3 sample resident comprehensive care plans. So this is in addition to request for portions of the care plan in other core areas. And once again, so please be sure to strike out any resident names or information. For relationships, we will want the building floor plan Again, not to be too repetitive, but the fire plan, the evacuation plan is fine. But we just need to know the work areas, including the number of residents who live in each area. Again, if you're doing sleep, reminder again that you only have to do this one time, so you only have to pull it once. Examples of weekly, 2-week, or monthly staff schedules for that work area. Again, include a key or directions on how we should read the schedules. Include a designation if schedules are not separated by work area that lets us know who works here. You must submit day sheets as an example. If you're also being evaluated on sleep, again, you only have to submit this one time. For mental health homes, they can submit the above documents if they choose to, but they are not required. So what we need from them is to submit their new employee orientation checklist and the direct care staff jobs description. So anything like CNA, CMA, bath aides. Decision-making resident care. So again, for this, we just need the outline for the risk training that your home uses. And then we need attendance records maintained for the risk training. So be sure to include the total number of staff members employed in your home. And for this, we do need the 90% of all full and part-time staff. You don't have to include PRN, but in your building, all full and part-time staff. For mental health homes, you just need to submit your new employee orientation checklist and then 2 to 3 care plans. For decision-making staff work, a list of individuals on your leadership team and their title, the role they serve in the organization. So for example, if you have a central leadership team, who's on it? If you have work area leadership teams, who is on the team? If you have work teams for core areas of the peak, who's on those teams? And then we ask that you have minutes from leadership or work team meetings held in the last 2 months. So the look back period from whenever your evaluation, 2 months prior to that. For career development, we will need a copy of your formal career development policy or your skills enhancement policy. We need a list of non-managerial staff who attended outside training since July of the last year. Include the type of training they attended, their position, title, and the organization. So keep in mind that with this quote outside training, you can bring someone in. So if you have a county nurse or someone from a hospice company, they can come in and do an in-service, and that does count as outside training. For this, we do need the total number of non-managerial, so no supervisors, department heads, managers, of the staff that your home employs. For resident bedrooms, we will just need a copy of your policy. And then we also need some pictures of rooms within the home that have been personalized. So resident bedrooms. This one's very straightforward. So resident use space, we just want pictures of your nurse's workstation, work areas. And then also if you just have really cool, interesting resident areas that they have to host or spend time, feel free to include those too. But just pictures of resident areas in nurse's station. Supporting the human spirit. So we need any tools or any information collecting that you guys use to gather information about routines, preferences, and daily pleasures. We want you to submit at least 2 care plans that do address daily routines and leisure preferences. Um, please snip out the parts that don't have anything related to this. We don't need the whole comprehensive care plan. And again, make sure that there's no identifying information. Community involvement. So interview tools to gather information about the residents' external community connections. So this can be part of your getting to know you, whatever you use. And then we need at least one sample care plan that demonstrates community involvement. Again, just the part that includes community involvement. We don't need the whole thing with no identifying information. Okay. So that is all the cores. And so right now, the point of contact for each home that we have in our system, they should have an email that tells you when your evaluation should take place, since they are all scheduled now. Whether that is virtual or if we have evaluators coming on site in person. There should have been a blank copy of the interview pool tool, and then a list of the new cores being evaluated, and then a list of cores being reevaluated if your home is due for those. And then kind of the option of self-report not passing, instructions on that. So with the option of self-report not passing, this is you telling us that you're not going to pass any of the cores that are being evaluated for the first time or being reevaluated. This could impact your level in a negative way, reducing your incentive. We do not want homes to do this if there's any possible way that they could pass their course. So we just want to have a conversation with the home before that decision is officially made. But so if anyone is questioning their readiness, we just want to talk through that. Okay, so for the in-person evaluation, that is where the resident interview pool tool is necessary. So after evaluators show up, this tool will need to be given to whoever's facilitating that from the peak side of things. And so we don't want homes to fill this out too far in advance. We really prefer if they could do it the day of, but kind of have a game plan, prior. Since we do understand that, hospitalizations happen, residents get sick, they might just decide to sleep in and they're not ready. So we don't want evaluators going and interrupting residents who might not be up to it. So there are more instructions on that tool, but that's just a general overview of what that is. So the timeline for the day, like I said, evaluators show up. Whoever is in charge of that resident interview pool tool will give that to the facilitator on the peak team. And then we will go ahead and start the team interview. And remember that we need to have 2 direct caregivers on that team interview going. And so depending on how many cores you have, that could take shorter or longer. But if there's 2 cores, depending on what they are, it'll take at least an hour or around an hour. While the team interview is going on, there will be direct caregiving interviews and the resident interviews going on. So part of our team will be out and about in the home. And then after that, after those interviews are done, we'll kind of be walking around, just taking observations, seeing how spaces are being used, how interactions are going. And so after we kind of have the groundwork for what we need, we might ask for additional documentation, or we might just have follow-up questions. Depending on the time, our group might break for lunch if it's that time. If not, we'll just keep on following up on the things that we need. And then after lunch, we'll check back in and see if the home has the documents that we need. And if they do, great. If there's anything else that we need to follow up on, we'll do that pretty promptly, and then we'll be on our way. But before we leave, we kind of have a little check-in with the homes, and thank you guys for taking time to visit with us. But that's your chance to ask us any questions too that you might have. But you can obviously ask us any questions throughout the day. But that's generally what a typical in-person evaluation looks like. So like I was saying, so for the full and partial evaluations, there are 4 evaluators that come on site, and then they do split. And so 2 of those 4 are from KDADS and not from K-State. For the mini evaluations, there will be at least 2 evaluators, and they are K-State staff. This year we do have students participating with us, so that's why I say at least, because they enjoy shadowing and getting out in the field with us, so we might have students with us. And then for the team interviews, like I said, we need at least 6 team members to sit in on that, and then 2 of the 6 should be direct caregivers. So CNA, med aid, housekeeping. And we want someone who that is their primary role. We aren't looking for someone who is the activity director, but happens to have their CNA. We want to have someone who's actually working as a CNA. So if we're doing a virtual evaluation, it is only going to be the team interview portion only. There will be 2 to 3 evaluators on the call, and so that just depends if anyone is shadowing or if we have students. But it typically is just a scribe and the facilitator asking the questions. And so same thing applies for who we need to attend from the home. So we need a total of at least 6. You can have more than 6 for both on-site and in person. But at least 6, and then 2 of those 6 should be direct caregivers. Please make sure that your camera and audio are both working as needed. If you need to, join the call early and test it out. But we try to keep these back to back, so that way we can be quick to stay on schedule and then have a little bit of wiggle room at the end of the month. If we need to if a home needs to reschedule. So please be mindful of joining on time and being ready. But we do understand tech can be tricky sometimes. So what happens after the evaluation? So usually in about 2 weeks after the evaluation, you guys should get your results. If there's anything that you don't agree with, or if there's additional information that you guys thought of after the fact that could help, that it could change the result of that, go ahead and do an appeal and then submit any additional documentation that you have. The steps for this are found in the guidebook. After evaluations, don't forget that you still have to do that KCCI survey. Again, that's always due on tax day every year. And then also on April 15th, we need your action plans for 25-26. And so just a reminder that you only have to do 2 cores, but we don't recommend doing a whole lot more than that, because we know it's change is hard, and so sometimes less is more. So if you have any questions on that, we will be sending out information for action plan coaching calls. So if you have any questions about any of the cores or kind of want to talk through what specific outcomes might mean for your home, anything like that, we'll have scheduled signups for those. So those are due April 15th, and then our team will review them and then get them back to homes on May 30th. So if you guys have any questions that you think of after the fact, after today, you're always more than welcome to give us a call and leave a voicemail if there's no answer. But the best way to get in touch with us typically is emailing us. Our email is coapeak@ksu.edu. But that's probably the best way, but you can always call too. And then lastly, please notify us of any updates to points of contact or any information changes in the next few months, especially. And then due to evaluation season, we're going to pause lunch and learns until May. That is a brief overview of evaluations and kind of what to expect. If anyone has any questions, feel free to type them in the chat, email us, whatever you need. We're here to answer questions and be helpful to you all. But I thank everyone for attending. I hope everyone has stayed warm this week. We've heard lots of really cool stories about staff stepping up. So something else too, if you do have a staff or home shout out that you want to give from this winter storm, please send those to us via email, and we are wanting to kind of compile a cool list of things that nursing homes across the state have been doing to meet residents' needs when things aren't super great outside. So please send us any cool quotes, testimonies, pictures, anything. If there's no questions, you guys are free to go, but Madison and I will be on.
This is Heather from Leonardville, and I got on late. And Jennifer Kinderconnect's not here today. What is the due date for everything?
So it's going to be 2 weeks prior, that Friday, 2 weeks prior at noon.
So all of our stuff has to be to you 2 weeks prior to our eval. Okay.
Yep.
Okay. Because I was thinking last year when we sensed there you guys wanted it, and because we didn't have eval, and I was like, oh, I need to double check with them. Okay.
Yep, that's all.
Thank you guys.
Thank you. Okay, so I had a message from Logan Holt. How many residents are interviewed on the on-site visit? So let me double check the interview pool tool, but I believe it is based on the home size, because obviously if a home has 30 people, 10 is going to be a very big number for them. So let me double check before. Okay. So for full evaluations, we're looking for 7 to 11 residents, and then if it's a mini or a partial, 5 to 7. But if you are a much smaller home, that does look a little different. So our team would be very understanding of that if you do have a smaller amount of residents to choose from. Does that answer your question, Logan? Great. And You should have a copy of this. If you don't, I can resend it if needed. But it should have been an attachment on um the eval confirmation. Any other questions? Madison, have you gotten everyone's attendance or do you want me to copy it over?
Nope, I think I have everybody.
Okay, perfect. I started writing them by hand and then
Yeah.
yeah. I just need to copy this.
I
Copy and
don't
paste.
think quite everyone chatted in, but I got whatever their Zoom name is.
Okay. We'll stay on for a few more minutes in case there's any other questions.